The wider population where we use the biomarker is as a cystoscopy substitute. Instead of a cystoscopy, we perform a biomarker to the patient. If the biomarker is positive in our center, we do usually perform surgery, biopsies, and TURBT. We do not perform a cystoscopy, we directly go for biopsies. But this is not the only setting for the use of the biomarkers, because in certain patients with suspicious or positive cytologies where you do not find bladder tumor, or there are like repeated positive cytologies, even for upper tract, this biomarker, if you have a negative result after several biopsies and all that, you feel quite confident that these may be false positive cytologies, which is sometimes common. But as I said, the main scenario is the follow-up, and also for some patients with a hematuria or a suspicion of a bladder cancer, in the diagnosis, we also perform the biomarker, and depending on the result, we may take the patient to the operating room.